Melanie Walker. I'm an epidemiologist and the research scientist for the Department of Emergency Medicine.
Hi, my name is Susan Bartels. I'm in the Department of Emergency Medicine, where I'm a clinician scientist, and I'm cross-appointed with the School of Public Health Sciences.
My name is Judy Fife. I'm the Executive Director of the St. Vincent de Paul Society of Kingston. We have been serving the Kingston community for 54 years, and we provide practical assistance for individuals and families living in poverty.
My name is Laura McDonough. I'm the clinical program manager here for the emergency department, as well as the sexual assault domestic violence program at Kingston Health Sciences Center. Our emergency department and urgent care centers service approximately 120,000 clients across our region. We're a wide-ranging service that provides level 1 trauma as well as stroke for the Southeastern Ontario and the cardiac programs. We work very closely with our community partners.
As you know, emergency departments play an integral role in providing health care, in particular for patients who identify as equity deserving, such as those who have mental health concerns, 2S LGBTQ+, among others. And we know that equity deserving groups report concerns about the care they receive in emergency departments, including feelings of judgment, having their medical issues in particular not being taken seriously, experience disrespectful communication, and have been subjected to stigmatizing attitudes and behaviors compared with those who don't identify as equity deserving. And at present, we are also facing unprecedented rates of burnout among frontline healthcare providers, including physicians, nurses, and allied health professionals, and extraordinarily stressful work environments, all of which themselves contribute to negative patient care experiences. And it's also likely that the risks of provider burnout resulting in patient dissatisfaction are higher actually for our equity deserving patients. And if these negative care experiences create either delayed care or avoidance of care, the larger impact will be an exacerbation of adverse health outcomes among our most marginalized populations. So in collaboration with several community partners, including St. Vincent de Paul, we're going to be conducting a mixed method study to engage with equity deserving patients in the emergency department and their healthcare providers to closely examine their care experiences at a single point in time. And divergent perspectives in the care experience pathway are going to help us to identify targets for intervention and develop strategies to improve care experiences among equity deserving patients and hopefully contribute to greater provider satisfaction with their work.
So building off our earlier research, our team will launch a participatory mixed method study to examine both patient and healthcare provider perspectives on emergency care in Kingston. To do so, we'll use an innovative sense-making approach. Sense-making is a mixed methods tool that is based on the premise that storytelling is a natural way for us to convey complex information about our experiences. SenseMaker empowers participants to communicate what's important to them by sharing and then interpreting their own experiences. Collectively, the participants' responses come together to create a nuanced picture in the same way that pixels come together to produce a clear image. In doing so, SenseMaker will leverage the wisdom of the crowds, or in this case, the wisdom of our patients. Our upcoming research is also innovative because it is participatory action research. Participatory action research differs from traditional research because it enables action through a reflective cycle. It considers power relationships, and it advocates for power to be deliberately shared between the researchers and the researched. We are confident that this work will help to identify concrete strategies to improve emergency department care experiences, including addressing systemic racism, as well as individual stigmatizing attitudes and behaviors. And we know that historically, these have been experienced largely by equity deserving groups in our community. By including providers, the project will also identify provider and system-level barriers to implementing improvement strategies. Since difficult interactions can contribute to health healthcare provider burnout, we believe that improving providers' experiences with respect to challenging interactions may help with provider well-being while playing a role in mitigating burnout symptoms.
The St. Vincent de Paul Society is really excited to be part of this project for a variety of reasons, mostly to do with the giving voice to our clients. We know that that often in society doesn't happen. Our clients often feel invisible and unheard. So I love this approach, and it is so very important. Many of our clients will not access healthcare when it's needed because they have apprehension about accessing the emergency department or other healthcare providers. Building a bridge between the provision of service and those in desperate need of it is critical to improving the health and well-being of our clients. We know at St. Vincent de Paul, as we serve a group wide-ranging, very diverse, all suffering in poverty, we know that simple acts of kindness, gestures of taking time to listen, identifying someone by name, addressing their immediate need as best we can. These things help to create a positive experience for the client, encourages them to come back to get their needs met. It also creates a wonderful work environment for our staff and volunteers. It becomes a very positive experience as opposed to something that can be a little intimidating. Anytime someone needs to reach out for help, it can be shameful for them. By providing an environment of positivity, of warmth, of acceptance, of non-judgment, really does encourage community to develop. The intention of creating better communication, identifying needs in a kinder, more gentler way, not only increases the client experience, but really does create a positive environment for staff, for volunteers. And when dealing with this particular client group, that increases safety. We have individuals who are homeless, who are dealing with addiction, who have serious mental health conditions. A positive environment also is conducive to a safe environment.
No, I think we would just, additionally thank many of our community partners. We're so fortunate that Judy and others in the community have really engaged with this research and feel quite strongly that it will have an impact, not only in the emergency department care experiences, but also out in the community where they hear a lot about those experiences frontline in our community partner organizations. So we thank them.
So the impact of this research will be far-reaching, and we're looking forward to working together with this group and taking back our findings and integrating it within our programming here.